Good afternoon, everyone. Hopefully everyone can hear me. My name is Andrea Bonacci. I'm the Director of Population Health Programs with AHI. Welcome. Today is the first day of the summit, the 2021 North Country Leadership Summit, emerging from a year of change and opportunity to rebuild and reimagine. I will be introducing our final presenter of the day shortly. First, I do want to take an opportunity to thank our sponsors for supporting this event today. The event is brought to you by Adirondack Health Institute and Fort Drum Regional Health Planning Organization with support of our many generous sponsors. Just a few housekeeping items. Please place all of your questions and comments in the chat, and staff will ensure that your questions are answered during the Q&A session at the end of the presentation. All attendees will remain muted with videos off to ensure the best broadband connectivity. And all presentations are recorded and archived in the North Country Leadership Summit webpage. They'll be available by October 1st. We do have sessions taking place throughout the week for Summit at 10 a.m., 12 p.m., and 2 p.m. daily. So I will go ahead and introduce you all to our final presenter for today, Julia Prusik. She's the Manager of Product Development with Hixny, and she'll be presenting Leverage Smart on Fast Healthcare Interoperability Resources to share actionable healthcare information. So Julia, I'm going to mute myself, turn off my camera, and let you take it away.
Thank you so much. Great. Let me just share my screen real quick. All right. Great. So thank you so much, and thank you guys for having me today. I'm really excited to share with you how Hixny has worked to leverage Smart on FHIR as a technology. I am Julia Prusik. I am the Manager of Product Development at Hixny, and I think many of you are familiar with Hixny. But for those of you that aren't, I really want to dive into who we are as a company a little bit before I get into how we've really gone on to start working with Smart on FHIR. So I want to share with you our data. Our Hixny's data is what we are, what is our most valuable piece of information for us to share. So Hixny, it has data from 44 hospitals, which is 100% of the hospitals in our region, 78% of our physicians, and 87% of other regulated entities in New York State. We cover the territory on the easternmost side of New York, excluding New York City and Long Island, and then we do branch into Vermont as well. We have 6.4 million patient records and 5.3 million consents for our facilities to view those patients' specific records. We are also part of the statewide health information network of New York, and this allows us to take our data that we have from our patients and share that with other areas of New York, and also to pull data from those folks and their connections to others. So we really do have a territory where we cover pretty much every single organization that we're able to in New York for patient data. We have multiple different types of data that we have within Hixny. So primarily we have clinical data. This clinical data is from clinical records, hospitals, different practices, specialists, etc. And we also do have administrative data, which is more on the claims side of data. We do consume social determinants of health. We're working to bolster those numbers a little bit. And occasionally, in certain circumstances, we can receive patient self-reported data as well, and we can share that with other community partners. So I kind of want to go through what our existing data exchange looks like. So this is prior to Smart on FHIR, the specific ways that we could exchange data and exchange that data that comes from all over New York, we could exchange that in kind of 3 different ways. The first would be the ability for EHRs to directly consume a CCD pull from us. So a CCD is a standardized format of data. It is limited to only structured raw data elements. And some of those data elements are kind of like procedures, medications, radiology results, etc. Unfortunately, though, with that, we had no control over the presentation of these structured data elements in the EHR. So when you pull a CCD from us, you do get all those raw data elements, but that may come into your EHR as a document that you have to kind of read through every single page. And it also may come through as already parsed. And what that means is it takes the data element and puts it directly into your system, so you don't even know that you got data from Hixny. It just appeared right in that medication section underneath there. The other thing was that there's no access to unstructured data elements in a CCD pull. When you pull that information in, you only get those structured data elements. You cannot receive anything unstructured. So unstructured would be a document, a transcribed note, a transfer summary, or a ED report, etc., an operative report as well. Those were not able to be exchanged with CCD pulls. How we kind of got around this was we had our provider portal, and we still do have, of course, the provider portal. What this does, though, is it takes you out of your workflow. So instead of being directly in your EHR, we can view all those great data elements. Now you have to log into a separate system, search for your patient again after you've already searched for them in your EHR, wait for it to load, which if you've used our system, it can be sometimes challenging because we do have a lot of data that it needs to parse through. And then we also are required to have user management. So that user management comes in many different ways. We have to have one point of contact with every facility. They have to tell us who they can and who at their facility can and cannot use our system, as well as have every single user go through training on how to use our data in our system, as well as sign a user agreement. So a lot of overhead to using the provider portal, but it is a very valuable resource with a lot of great data in it. We did try and help this a little bit by getting our provider portal to have single sign-on. And what that single sign-on really solved was the login barrier. What it could do was the sign-on would be right in your EHR, and you could just kind of click a link, it would sign you in, but then you still did have to search for that patient, load the data, and the user management was still a big barrier for our folks. So what was great was Smart on FHIR came about. And Smart on FHIR, for those of you who aren't familiar with it, it's really just a word that should be synonymous with interoperable. Smart on FHIR is the ability for healthcare companies to create one app that is able to be launched across the healthcare setting. So in multiple different types of EHRs, it gives you a framework for how you can do that in a reproducible way. So what's great about all of the EHRs that our participants, our clinicians, our hospitals use is those EHRs already know who you are as a user and the patient that you're looking for. It has the identification for both the user and the patient, and it can pass that directly to us. To do that, we use the Smart on FHIR. And if you don't know what Smart on FHIR is, it's a great jargon word that a lot of people love to throw around, but really it's two separate things. Smart is a launch sequence between an app and an EHR. So it's actually kind of a handshake. The Smart sequence just discusses how the user and the patient information needs to be exchanged. So it kind of tells you, I need this specific handshake in order to let you into my system. It has to be this secret handshake. And then the FHIR aspect of that is just the language that the data needs to be exchanged in. So once you've actually made that connection with that Smart launch, Then FHIR is how that data comes back and forth into the information. So when we work with an EHR vendor, we work first with SMART to receive the user identification from that system, say that we trust them, we know who you are, and we have certain credentials. And then we take FHIR and say, okay, now send us a certain amount of information on the patient so that we can match them up on our end and give you back that data directly into your system. So Smart on FHIR, again, it's a very jargony word. So a really easy way for me to explain it to you is in a system that you've probably used every day. So anybody with a smartphone has used a system similar to Smart on FHIR with your apps. So Spotify is a very common music platform that a lot of people use. You can download it as an app on your phone. And what's really great is that you have the ability to log in with either Facebook, Apple, or Google. So you do not need to re-log in or directly log into Spotify. You can use your credentials from folks who are trusted between Spotify and the third-party company. And you can say, hey, Facebook knows me. Spotify, you should let me in because Facebook knows me. And it will. They are set up so that they can single sign you onto that. And you no longer have to go through all of that. No longer do you have to do any user credentialing. You don't have to sign in specifically. It'll automatically log you in with that secret handshake. So once we were able to identify that this was certainly a technology that could help us address the barriers that we had for our users, we went to actually talk to the users. And we talked specifically to emergency room providers, primary care facilities, specialists, and care managers. And we talked to them about what was really important for them to review on a patient. Hixny has a ton of data, but there's only specific data that each of these folks really needs in a clinical setting right at their fingertips to be able to improve care of their patient. So we came up with this list, documents, labs, radiology, procedures, conditions, meds, who their primary care doctor is, any allergies that are extremely severe that you need to know about immediately, and then any additional patient contact information. All of these things were in varying ways important to those users that we discussed with anecdotally. And it was really eye-opening to understand specifically the use cases to why this information was important and in what scenarios. So from all of this information and with that Smart on FHIR technology, we were able to launch our version 1 of our snapshot. So this snapshot does not give you every single data element that Hixny has. But what it does do is it gives you information that you can utilize quickly and efficiently in a care setting. You know, if you are doing a pre-visit planning, you can use this information for recent changes in the patient's chart, or you could use it with the patient right in front of you. For example, you can see those quality indicators. I immediately know that my patient Ava here has her qualifying breast cancer and cervical cancer screenings, but she does need her colon cancer screening. She is eligible and she needs that for whatever qualifying reason she has. We were previously not able to show those quality indicators on any standardized method. So that was not a place in the CCD exchange. We could not send those quality indicators over that CCD. And then within our provider portal, it was very difficult to put that into a place that made the most sense. So here we have that right up in front. And while we were actually developing this, we also realized a need for a new data element type or some other data elements that needed to be brought to the forefront. And we were able to quickly and efficiently identify COVID-19 information. So you have the COVID-19 vaccine status. If the patient had a PCR test or an antibody test, we can show that and display that very quickly. So this was our version 1. We got great feedback from this. What this does is it shows you the most recent 7 data elements. You can click to see more information on labs, radiology, and documents. Then you can print certain pieces of this information. And what we did was we took this and we launched it with both Cerner and Epic. And here is kind of a screenshot of the day we went live. We had a screenshot of this in Cerner on a real patient who's been de-identified, but this was right in the patient's chart. So in Cerner, this is the patient's header. This is on the left-hand side where all the data elements reside. You can click on your medication list and your allergies, and then you can click down here to Hixny to receive this right in the workflow. There's no logging in, there's no searching your patient. It's right here very quickly. You can see all of this information. And first day, one of the first patients we pulled up when we went live was this person. And we had some needs for him, as well as some things that we were able to identify that he had immediately. So from this, we've really seen that this has broken down a lot of barriers. And to kind of show you that, I'll show you some data. These are the launches, the number of patients searched in 2019. In all of 2019, there were about 3,000 patients searched from this same facility that we launched with in Cerner. They, in 2019, pulled 3,000 patients. In 2020, we did see a little bit of a jump from them and most organizations just because of the pandemic. Telehealth was a little bit more prevalent. And we did see nearly 6,000 over the entire year patient searches in Hixny. But what was really special is that when we went live with our Smart on FHIR application that broke down those barriers to accessing the record, we got 10,000 clicks, or excuse me, 10,000 launches between May and August, which is 4 months. So we've blown away the previous year's statistics with this Smart on FHIR application. And this is the same organization, 2019, 2020, and then this year from May to August. So really, really great numbers that we're seeing. Because we saw such great numbers, we were really excited to work on our version 2. So for version 2, we were able to expand our existing data. So no longer do you just have to see the most recent 7 data elements. Now you can dig into the record a little bit more if you need to. And with that, we added a little bit more functionality. So if you have more data, you need an easy, quick way to get to what you're looking for instead of just diving through that data forever. So we added some new searching, filtering, and sorting functionalities. And we also added the ability to download directly to PDF, or if you're in a qualifying EHR, we can do FHIR write calls directly. So a FHIR write call, for those of you who don't know, that would just be contributing data from our application directly into the EHR. So the EHR can take that and put that into your medications list, for example. Or you can take a document PDF and put that into your documents tab in your actual EHR. I'll show you what version 2 looks like. So version 2 was launched last Wednesday, actually. So we're very excited about that. Looks pretty similar in format to our previous version, but there's a couple new data elements available. We have patient history, which is social history. We have advanced directives for patients that have that information. And we also have the same quality indicators and COVID-19 status. You can see that as well with the latest PCR test and the antibody test, and that vaccine is still present. We do have more than the most recent 7 data elements with these See All tabs. So you can click See All. And now you're able to see all of the existing information that we have on a specific card. So this is radiology. We have 54 radiology results, and that's kind of a lot to go through. So we have the ability now to take this and you can sort through. Maybe I just want to see Ellis Medicine and Saratoga Hospital, so I'll just click those, and you can see on this now only Saratoga and Ellis is available to populate. And then I can also search for, if I wanted to look for a mammography, I can go in here, start typing mammography, and I'll get anything that turns back with that information. If I click on that, I can now see what that mammography looks like. And I do have the ability to either export as PDF, or again, if it is in a specific EHR, it can directly write back to the EHR to tell it the information. So what we're really excited about is what you can see here is this is how we've formatted our PDFs. I used to work in a clinical practice and I always had to sticker every single page. Now we've kind of created this header up here, if you can see that. We have the patient's name, date of birth, facility. We've put the MRN from whatever facility the viewer is looking at the patient through, and then the record type and the date that that specific record was received. On the bottom, it'll also show you the pages, so how many pages you can expect. And this is on every single page, so you no longer have to kind of lose, pages or have them out of order. Everything is all concise and identified for you. So the other work we've done is we've added the ability to hide my personal data. So if I am a user from Saratoga Hospital, I want to hide my data. All I have to do is click this button, and then my information, the Saratoga Hospital, will disappear, and I no longer have to look through my own data. I already know what's in my own record. I just see what's and you can also, of course, click into any of these sections. Specifically, if you wanted to click into see a document, you can see this document immediately. And right now we are working, we have our version 2 in test with Cerner and Epic. So we are working on validating those so that those will be available to our downstream participants soon. And we can have use of the new snapshot right in this, this EHR workflow. So what's next? What's really exciting is that we have been able to show success in such a short amount of time by removing the barriers to access, and we're seeing that more people are accessing. But what we want to continue to do is ensure that we are improving the time that it takes for folks to actually access this data. So what we're doing is we are monitoring clicks. We are taking users' clicks and anything that they filter and anything that they search. We're aggregating that data to look at what is really important for folks when they look through a patient's record, and seeing if we can identify some trends here to pull that information out to make it more easy for you guys to use in the future. This allows us to further customize and highlight that important information in the record, and we can bring that to the forefront for you so that decreases the time that you're taking to look through old records. We're also adding new data elements. So we have vital signs in our HIE, which we would love to be able to show front and center. But we also have patient visits and admissions. What we really want to do is categorize those visits and admissions into what's really important for everyone. So ER visits, inpatient admissions, primary care visits, annual primary care visits, and then specialty visits. We want to categorize those so that you can see where your patients been, what services they're already utilizing, and you can identify what they are in need of moving forward. We also have care team identification. So we're working on identifying a patient's care team in a very similar way to admissions. We want to actually identify who specifically is working on that patient's record, who is in charge of that patient, their care manager, if they have one, their PCP, any specialists that they have involved, and who can be contacted for this patient for any services they already have, or if they need future services, maybe they already have some existing connections in the healthcare community. The last thing that we're really excited about working on are our partnerships. So we have two very exciting partnerships that we're working on this year. And we are working on care management identification as well as risk score calculation in partnership with the North Country Care Collaborative. And we're also working on a social referrals platform with Healthy Alliance IPA, the Adirondacks ACO, UVM, and many others in our community. And I will go into detail on those a little bit more. So in our partnership with NCCCC, we are working on displaying the existing care management facility, as well as identifying patients who could benefit from care management services. So I have a little bit of a mock-up on what we think this might look like. Again, this is a draft. We haven't finalized anything. This is just kind of to explain what we're trying to accomplish here. We have the ability to identify the care manager from many different avenues. So we can put that into the patient's record front and center so you can identify who that person is. We can also identify the risk. So if they're at risk for severe mental illness, they've had 4 ED visits in the past 6 months, they have a history of homelessness and food insecurity, we can really identify them as an at-risk patient who could really benefit from care management. We can highlight that in their record front and center so that that is something that either a discharge planner can act upon or maybe a PCP can act upon. But as soon as they see that, they can identify and work on that patient's needs. We also have our social referrals platform, which we're really excited about as well. And the social referrals platform gives us, we're in the early stages of this, but this will give us the ability to allow users to search for community-based organizations and view prior referrals if there are any, or make new referrals. We're really excited about this opportunity, and I've mocked something up for you folks. This is again just a draft, but just so you can kind of see what we're trying to accomplish here. You can click into the community-based services. You could search for any services that you needed to, prioritizing any services near where the patient lives. And then you could also use the quick links if you had something specific that you were looking for that was already identified. If you did that, you could then look through maybe all the food banks that are near 12801, which is where my patient is from. Now I can see anything near that patient, and I can see the different services that I might be able to refer them to. Click refer on the side, and then you're just one more click away from actually sending a referral from the person. We know who's logged in. We know where you're from, the hospital. We know the patient that you're searching and that you've looked at their record for, and then you've chosen where you want to refer them. So it's just an additional click. If you have any additional notes, submit that, and then that can complete the referral. So we're really excited about all of these community partnerships that we have. We're really excited about all of the work that we've been doing to improve the snapshot, improve our Smart on FHIR capabilities, and get this information directly into EHRs and work with everyone to break down those barriers of access and get you the information that you guys as community partners and clinicians need. So very exciting stuff. I am looking forward to hearing kind of your thoughts on what we've done so far, and if you have any ideas for some future projects that you'd really like to see, love to hear any of that. But right now I'd like to kind of open it up for questions.
Thank you, Julia. So if you have questions, please feel free to go ahead and enter them into the chat box, and then we'll go from there. Julia, just a comment that came in from Mary McLaughlin of AHI that this is exciting and thank you for continuing to expand on the functionality and looking forward to the care management and social support information. And then we did just have a question come in. What does the user food distribution on this sample need to have to obtain the referral? Julia, is that something you're able to answer?
So we are working currently on this project. So we are working with Open Referral, which is the kind of standard format of what people need to send and then receive to actually make a referral. So I will have more details on what exactly those requirements are, but if you leave your contact information, I'm happy to follow up with you on that.
Thank you, Julia. Any other questions? Please put them through the chat box. And Julia, if you would like to share your contact information in the chat, if anyone has any questions that they think of after or want to follow up with you on anything, feel free to do that as well.
Absolutely. Great. Is there any other questions that I can answer for you folks?
If there's no other questions, Julia, is there anything else that you would like to touch on with regard to the information that you just presented, or anything else on the horizon with Hixny?
We have so much on the horizon with Hixny, and we're really excited about it. We are working a lot with different community partners, and we have a lot of those partnerships. We also are working on incorporating new vendors. So right now we are working with Cerner and Epic, but we are working with some community vendors. So NetEnt, NetSmart are a couple that we've started discussing with, ECW. So if you guys have specific vendors that you'd like us to work with, or you know that they already have this capability available, please reach out to us. We're very happy to work with any vendor. Right now, we're kind of just waiting for those vendors to become available and make their Smart on FHIR capabilities available. But we love to hear, the requests from everybody on who their EHR vendors are and how we can best support you. So any ideas you may have or any projects that you may like to collaborate on, please feel free to reach out to me. My email address is in the chat, and I'd love to hear that.
Thanks, Julia. And I know that, Hixny has certainly come a long way with regard to data, in particular with a lot of the new registries that have come out in the last couple of years, getting to look at, chronic health conditions and ED specific or inpatient specific hospitalizations, which I know anyone working in a clinical setting appreciates. We have another question that just came through. The question is, when you say hide my data on the snapshot, does that mean hide data from my organization?
Gotcha. So yes, what that means is whichever organization that you're accessing from, we will automatically hide the data from your organization so that you don't have to go through that data. You may already know what that is. You may have looked already through your charts. We want to make sure that that data is hidden so that it's not reproduced if you don't want it to be.
Any other questions that Julia can answer? We do have a little bit of time left. If there's no other questions, we can close up early, but I'll give it another minute if anyone else thinks of anything. Okay, well, I would say if you think of anything else, you have Julia's contact information. Julia, thank you very much. The presentation was very informative. And thank you to everyone who was able to attend today. And please be sure to take a look at the presentations that we have planned for the rest of the week. And we'll give you back some of your time. Everyone have a good afternoon. Thank you.
Thank you so much.